Back. Welcome back to TSPN. I'm Lennox with the American Legion, and I'm chatting with Nicole Vasquez, Operations Manager of American Legion Ambulance. We've touched about a lot of subjects this morning. I'd like to go back to that system status plan. We have a plan for Amador County.
Yes.
We have a plan for Calaveras County, and then we have also a plan for both counties.
For both counties.
Now, that would involve both dispatch centers?
Yes.
Both hospitals? That sounds like it could be quite complicated. How do you manage it?
We stay in constant communication with the crews, with the dispatch agencies, making phone calls back and forth. We utilize that GPS tracking system quite heavily that I described earlier, where they're GPSed and we can find their locations within 2 minutes of their most recent location. We will actually, for example, if resources get low in Amador, we are already on the phone between the two dispatch centers requesting move up and cover resources from the other county. It's a mutual aid system. So we constantly have ambulances moving back and forth across the county line. We have the West Point car will back up the Pioneer car and vice versa. Coverage is balanced continually throughout the day. There's never a drawdown of resources in one county without movement of the resources available in another county moving over across to cover. So the residents of both counties always have coverage.
Another exciting thing that sometimes the public doesn't know about is our quality assurance. And that is where the rubber meets the road, because that's where we gauge how we're treating patients.
That's correct.
And we've had some exciting programs. Let's start with the pilot program that we did on heparin nitro.
Yeah, quite some time ago we did a hep nitro pilot study. It's an expanded scope of practice for paramedics, or it was at that time, and those were for patients coming out of the hospital facilities needing transport down to the valley hospitals for further care and treatment that we just don't offer up here in the smaller hospitals. So the hep nitro pilot program started because we saw a need for paramedics to have the skill set to take these higher acuity level patients down to the valley without requiring us to call in a nurse every time that transport was required. We petitioned to the state, we got our state scope approved to be expanded, and now that has actually become standardized for all paramedics in the state of California. So we were very advanced in getting that program to the residents that we service.
So a program starting here in Amador County is now state standard.
State standard.
Amazing. How about the STEMI program?
The STEMI program is much the same as the hep nitro. STEMI stands for an ST elevated myocardial infarction, which is it is a specific type of heart attack that is very, very lethal. So there are varying degrees of heart attacks. This heart attack tends to have a very high mortality rate. So what we have done is a pilot study for STEMIs, and we can identify those in the field now doing 12 lead EKGs, just like you would get in the hospital, and we identify certain types of heart attacks, and we actually can then triage those to an appropriate facility. Those patients are going directly into the cardiac cath labs down in the valley, and they are having amazing outcomes. Patients are going in for STEMIs that probably would not have survived several years ago, and they're getting fast care. They're getting immediately into those cath labs, and they're coming home in 2 days after they've had stents placed and balloons placed, and they're saving heart muscle. So those patients are having really good outcomes.
So in other words, rapid intervention is really making a difference.
That's correct.
And a significant impact on our communities.
Absolutely.
That's a great thing. We also have a sepsis study.
We have a sepsis study, and we're very excited about our sepsis study. We started last year with the help of our local hospitals, and we went to the region and said, we see that there's a high incidence of sepsis, which is a high mortality rate systemic infection that people can contract of all ages. Typically you think of sepsis being in the elderly population. However, we're finding that's not true. We're seeing that in young adults, we're seeing that in children. So we identified that this is a very serious health threat to our communities, and we wanted to get very aggressive about sepsis. Hospitals have been aggressive about sepsis for several years now, and in the field we felt like it was something our paramedics wanted to take on the challenge and really get aggressive in treating and intervening with these sepsis patients.
And how's it going?
It's going wonderfully. We have some initial data in, and we have actually been able to, there's a key thing with sepsis in initiating treatment. Fluids are the definitive treatment of choice with early sepsis.
Early hydration.
Early hydration. And those patients need to be copiously hydrated within the first 3 hours of recognition of sepsis. Now, when we were bringing them in the field without a sepsis alert or any sepsis treatment, those patients were sometimes an hour to 2 hours delayed in the recognition of them being in a sepsis condition and getting treatment. We've actually cut that time by an hour by our medics being able to recognize that in the field and start treatment with fluids. So we're very excited that we're cutting into that 3-hour window and starting to deliver those treatments on scene and during transport.
Now have we had any definitive data on that we're seeing better outcomes?
Yes.
Okay,
yes, we do have definitive data,
wow.
and we're excited about it because we're one of the first in the state of California. Again, like the hep nitro, we're on the forefront of aggressively treating sepsis and identifying it in the field. Many providers have a protocol to identify it, but they don't have a protocol to address it. And that's something that we've put in place, and it's making huge differences in patient outcomes.
It sounds like it. Pit Crew CPR. Now, I'm old school CPR. What's the new stuff?
Pit Crew CPR is very exciting. It is a concept just like pit crew in NASCAR. Everybody has a job. Everybody goes straight to their role. Things are done in a precision, timely manner, and it all is to reduce the amount of time that your hands are off of the patient's chest compressing. Evidence shows that compressions are the key to CPR, not respiratory, not breaths like we previously thought. It's reducing the amount of time that your hands are off of that patient's chest. So everything in Pit Crew CPR is designed to keep the compressor's hands on the chest doing compressions while all the other team is doing things to improve the outcome
Sure.
of the patient.
Sure, and
So-
that would include the cardiac monitor and maybe
Correct.
defibrillation and some of the
Early defibrillation,
Early
early CPR.
and some of the cardiac pharmacology.
Yes.
And things that we do every day.
Correct. And this was a program that was started in Seattle, Washington, and they have the highest success rate in the nation. They've been doing Pit Crew for about 10 years now, and they have seen their success rate where they have successful cardiac resuscitations up in the high 50th percentile. In Amador and Calaveras counties, we're seeing it at about 20%, which is outstanding because some inner cities like Detroit are seeing it down in the single digits, some as low as 4%, 6%. So while we do have a high rate in Amador and Calaveras counties, we want to see our rate up to the 50th percentile like Seattle. So that's where we're looking.
Yeah, we're always trying to improve
Absolutely.
what
We have our
do.
sights set ahead.
It's never good enough.
Never.
And never good enough. You're only as good as your last day, isn't it?
Absolutely. You're only as good as your last call.
Right. Stroke. We've done some amazing stuff with that,
We're
too.
doing a lot of stroke recognition in the field. Our medics are learning to identify the time window that we have to treat a stroke. We're doing early stroke alerts to the hospitals. Both Mark Twain and Sutter Amador are stroke centers. So they have really helped us implement stroke recognition in the field. And by giving those early stroke alerts to the hospitals, we can make sure that there is a team ready when we hit the door with those patients So they are going right into CT, they're getting their blood work done, and they're getting their stroke evaluations done to ensure that they meet the criteria for stroke intervention.
Right. Now, that's not all, but you do a lot of QI and QA. You attend meetings, you create policies, and you do consistent checking on our quality improvement and quality assurance of our paramedics.
Correct.
And then it's your responsibility, if it's required, to implement an improvement plan.
Absolutely. I read every PCR that every medic writes in this company, which is an average of about 750 PCRs a month. And I read every single one of them to make sure our medics are following protocol, delivering quality care. I'm reporting that data back to the region, back to the counties. And we're looking at that data to implement studies that we recognize that are needed, such as the sepsis study and the STEMI studies, but also to ensure that our medics are doing what they're supposed to be doing out there. And if we see anybody slipping below benchmark, we are taking measures to educate them and bring them back up to the level we feel we want to provide.
Right. I'm glad you came today.
Thank you.
I have been on TSPN numerous times, so folks tend to know who I am, and it's great that I had the opportunity to introduce you to the viewing community. Ladies and gentlemen, it's after interviewing this lady, now you know why things run so well. She's a dynamic force in the company, and she makes a huge difference, and I guess that's kind of why I hired her.
Thank you for having me today.
Thank you for being here. And one last thing before we close up. Patriot Day tomorrow, 9 o'clock at the American Legion Hall. If you can come out and commemorate the day, please do. Thanks for watching TSPN, and have a great day.
You're watching Amador County's #1 news and sports leader, TSPN.